morning, sir.
Am I correct when I said you had interactions with them yesterday too?
Yes, you're correct.
Give us an idea what happened.
Okay, thank you very much. Good morning to our listeners. You remember earlier when we spoke, I told you that the minister has been requesting for them to be part of a team to look at the roadmap towards the implementation of a condition of service. We've tried our best. Yesterday, thankfully, they agreed to attend a meeting, and the meeting was actually moderated and led by the CEO of Fair Wages and Salaries Commission, Dr. Smith Graham. And then various proposals were made, including getting this document implemented, but takes effect in 2026. As you may be aware, it's not part of this year's budget. Even when it was signed last year, the previous administration did not even include it in the first quarter budget. Even during the negotiation yesterday, it came to light that during the transition period, they asked whether or not there is a condition of service that has not been implemented. They were told that there is no condition of service that has not been implemented. On several occasions, they asked because they know that it normally have some implication on the budget. But all of these things, anytime they say, oh no, there is no document like that. Until the Minister for Health find out that there was a document, and then we started this discussion. So we in the ministry, we have actually shown good faith. We have actually facilitated all the meetings you see. For now, we are only pleading with them to go to work because it is evident that the Minister for Health has led this whole discussion, has provided a lot of platforms for them to vent their anger and talk about their issues. We're only pleading, as we have continued or we are currently negotiating or currently having discussion on this particular roadmap, we are pleading with them to go to the hospitals. Yesterday, when we said this, they also countered our proposal with a proposal of getting us implemented now and backdate it to last year and make payments to last year. And we said if it's not in our budget, it will be difficult. However, we'll continue to engage. Since they said they are going to inform their National Council and get back to us, we want them to go to work once we continue this engagement. Only for us to see it in the media that the proposal has been rejected and the strike continues unabated. We were taken aback. We just envisaged what was happening in the hospital at the time because now it's free for all. Even though the hospital managers are doing their best, people just come walk around the hospital. If you do a nurse, they tell you that I'm in the nurse, I'm relaxing. So we are just looking at what is happening in the hospital, trying to provide mitigating measures so that you and I or our relatives anywhere, when they go to hospital, at least there will be some skeletal staff there that will provide care to them. The Ghanaian people are suffering in the hospital, my brother, if you go there. So we are pleading with our colleagues to see reason with us in the ministry and go to work whilst we continue this negotiation. So now what we are talking about is an upward adjustment of the old agreement. In the shadow, we have two. We have the old and the new. Currently, the old is being implemented. The old is taking effect. The upward adjustment is what we are discussing currently. We are pleading with them to go to work whilst we look at this upward adjustment.
I see. Let me read to you because you were just saying that it was never because this is the vice president of the GRNMA, Alakora Akologo, who says, we were told that there was no budget provision for it. And these conditions of service were presented to the government in January. And we expected that they would be factored into this year's budget. Unfortunately, we are being told that the challenges of the implementation are such that they have budget constraints. So they are saying that you actually knew about it in January. So If you wanted to put it in the budget, the government could have done that.
Yes, Adam. You want to agree with me that currently the finance minister is not ready to throw this economy into disarray where you just take everything on board, just look at it any time, you just add it. We can add it and you're adding it. If it's not properly planned for, it will be difficult. The economy is now taking shape. All of us will have to at least have it at the back of our minds that we are in a crisis, we are coming out of the crisis. We need not to send this country back to where it was. So if the finance minister has looked at the various budget lines and said it will be difficult for us this year, so let's look at it next year, and then we stagger the arrears, I believe that that is our proposal. So if you've gone to your national council and then you said, okay, we are having another discussion, come back to us, tell us what your proposal is. These are our counter proposal when we went to our national council. So look at it. Yes, if it's budget constraint, that is the truth. We have to be truthful to our people. This is the situation. This can be taken this next year. So please bear with us. But if the minister says yes, it's due to budget constraints, I'm not sure. It's a shame to say that if that is the truth.
What is the middle ground here? Is there a possibility of a middle ground? Because you're saying the implementability this year will be difficult because of the constraints on the budget. They are also saying this was negotiated back in 2024. We need it implemented now. Is there a middle ground that can be considered?
So now the middle ground is agreeing to sign the document. You remember from the beginning, the issue is sign. When we finish signing, we can discuss the roadmap. Now, the minister has agreed to sign. He's looking at the roadmap because there are a lot of documents that have been signed and were not implemented. So let's look at proper implementation. Now he said no. The implementation plan you're talking about, we don't agree. There are a lot of conditions of service that has not been fully implemented. The 2021, the same thing. You want a facility to pay 13th month. It can be possible. It can be possible. Just imagine some chiefs compound or some health center in some village. You said they should pay 13th month to their salary. It is not visible. We are only looking at what is feasible for our nurses, things that are feasible for them. We are considering their welfare seriously, making sure that whatever we have said we want to do must be done, not just put it in a document and just throw it away and then say, okay, it's going to be implemented as and when and how it's going to be done, you don't know. That is why we are here. I think if we have signed and say, okay, it's signed, so let's go back to work, that would have been, but that is not the best way to go. We are looking at it and making sure that it's fully implemented.
So at this time, all you can do is appeal.
Yes, that is what we are currently doing. By close of day, if our appeal is not actually accepted, we have to look at other measures that will mitigate the effect of the strike on the people of this country. For us in the ministry, our main concern is how healthcare will continue without any further interaction, further delay for somebody who will go to hospital and have to wait for some hours before it's taken care of. We want to look at that and, if possible, redirect traffic in a way so that while doing this negotiation, our people will be okay.
But in the meantime, do you have any further engagements that have been scheduled to continue to speak to the nurses?
Yes, we were expecting to meet up with them today because they said they were going to discuss with their national council. But be it as it may, I'm sure we will have to call them to come back for us to consider whatever proposals they have.
See. Well, you talk about mitigation measures. What measures can you put in place now? Or have you been putting in place?
It's being considered currently. Team is in a meeting. I'm sure very soon the Minister for Health will announce this. That meeting has been scheduled to take place very soon and it to be announced by the Minister for Health.
But in the meantime, I guess this must be creating a very difficult situation because we as Ghanaians are feeling it. A ministry with a minister in place that is barely about 3 months old. This must be difficult.
I said like this. You agree with me that the minister was up and active, moving from one place to the other, making sure that healthcare delivery is given its newest look. You will agree with me that the minister has been looking at free primary health care policy, and currently is a team looking at this. You remember his work towards the launch of the Mahama Care. You remember what he did in Parliament to get the capping of the national health insurance to have this 10.7 billion for the various programs under the health insurance scheme. So he has started moving onto this. But I can tell you the minister is still hopeful, is still up in spirit, and believe that this will also pass, and then Ghanaians will enjoy the benefits of all the proposals we are putting in place.
Thank you. Thank you very much for speaking to us.
Thank you, Senator.
So as we speak, as far as the ministry is concerned, they are doing their best, but they do not have any assurances from the nurses for them to say there's an end in sight to the strike. The nurses are